Good afternoon, everybody. Thank you for joining me again for another Chuck Chat. It's May the 20th. I'm going to share my screen with you. If I look a little strange today, it's because it's Spirit Day at Westminster, and I'm wearing my 1980s Cardinals jersey and barbecuing or grilling burgers for the associates today in a way of showing appreciation. So here's the chat for today, and here's my screen. I'm just going to go through a couple Memorial Day remembrances. Memorial Day is coming up Monday. I'll have a special message for Memorial Day that's going to be on our 1890 channel. This is just a little cartoon telling us never to forget. I think that's very true. This life of freedom and peace has been brought to you by a soldier. It doesn't hurt for us to remember that on Memorial Day, but we should remember that other days of the year as well. It's one day, 24 hours long. That's 1,440 minutes, or 86,400 seconds, and an eternity of thanks. We owe a great deal of thanks to all of our veterans and our fallen heroes. The pen is mighty grateful to the sword. Here's the update on COVID-19 at Westminster. We have no active resident cases of COVID-19 at this time. All precautions and restrictions remain in place. This includes no visitors to our campus unless end of life or resident wellness, restricting trips to essential purposes, screening and temperature checks upon entering the campus, social distancing, hand hygiene, and mask at all times when outside of your apartment home. Excuse me. Healthcare update. So 7 COVID-19 positive employees since this all began back in early March. 1 on isolation at home currently, presenting with light symptoms, and they're again isolated at home, waiting to recover completely before they're allowed to come back to work. All residents and associates in the healthcare center and assisted living have been tested. As a precaution, no residents were positive, no new cases in the last 2 weeks. Essential visits are being allowed in healthcare now for end of life and resident well-being only, and those folks are being reached out to by healthcare and told that they can come visit on a limited basis. We are continuing to coordinate our efforts with the Texas Department of Health and Senior Services and the Austin Public Health Authority. Your questions and answers. What steps are necessary when residents return from a family stay? I would say, number one, this must be reported to us. You need to tell us when you leave for a family stay. Residents will be quarantined in their apartment and test 5 to 7 days upon their return. So after their return, we're going to wait 5 to 7 days. You're going to be quarantined in your apartment, and then we'll test you. And you'll continue to quarantine until the results come back. If you have positive test results, you're going to have to continue to quarantine, and we'll stop the quarantine 10 days with no symptoms. No repeat test. If negative test results come back, then you can come off quarantine immediately. What steps are necessary when residents return from an ER visit or hospital stay? This must also be reported. Quarantine in the apartment and test 5 to 7 days. So 5 to 7 days after your return, and you continue to quarantine until the results come back. If positive test results come back, then you'll have to continue the quarantine. We'll stop the quarantine 10 days with no symptoms. No repeat test results. If negative test results come, then you can come off quarantine right away. What steps are necessary when a resident moves into Westminster? And this is probably because, we have had some new residents moving in. We are quarantining those residents in their apartment, and we test them upon their move-in, and then they continue in quarantine until the results come back. If positive test results come back, then they're going to continue in the quarantine. We'll stop the quarantine 10 days with no symptoms, and no repeat test. If negative test results come, then they can come off quarantine immediately. If having symptoms, this is the procedure with symptoms. So if you report symptoms, this is what we believe is necessary and what the CDC is recommending. We'll get a test with the wellness clinic and quarantine in your IL apartment. So your apartment home will come to you and do the test. If positive test results come, then continue the quarantine. Quarantine will continue until 10 days after symptoms onset, and then 3 days with no fever without meds, with improvement of respiratory symptoms. So 3 days with no fever without medication, and at least 10 days from the beginning of the symptoms onset. There'll be no repeat tests, because typically if you tested positive for it once, you'll test positive for it again. If negative test results, you can come off quarantine immediately. If you're not having symptoms, but you had direct contact with a resident that was positive or another individual that was positive, we'll test you again with the wellness clinic and quarantine an independent living apartment, so your apartment home. If positive test results come, then we'll continue the quarantine. We'll stop the quarantine 10 days with no symptoms, and there'll be no repeat test. If negative test results come, then you can come off quarantine. Can you remind everyone to comply with the visitation policy and entrance procedures? Yes. Visitors are restricted except for end-of-life situations or resident wellness impacted. All visitors must enter through the healthcare center north entrance and be screened. No one should enter or be allowed into either building without going through the Preston or the healthcare lobby and being screened. So there should be nobody opening exterior doors for visitors and allowing them to circumvent that system. That screening's in place to protect you and to protect our associates. So please comply with those directives. And we are working on a phased reopening of the campus, and I'll be sharing information about that in the next couple weeks on how we're going to reopen. We'll start gradually reducing the restrictions and the precautions and reopening methodically. So be patient, we'll get there. Another question, what should residents do during these COVID-19 restrictions during when a tornado warning has been issued for our location? I really liked this question last week, and I wanted to put it in the slides again this week, because this is kind of tornado season, severe thunderstorms are popping up. So what you should do, if there's a tornado warning issued for our area, you should apply your mask and move to an internal location away from doors and windows, and shut your apartment door as you enter into the hall. So shut the door behind you, shelter in that location while maintaining social distance as much as possible. So at least 6 feet until the warning is over. So you ideally want to get in the hall, into an interior hall, away from doors and windows, away from any glass, and kind of hunker down in that area, maintaining social distances of 6 feet and trying to wear your mask the entire time. An announcement will occur when the warning is canceled over the emergency call system and the business phone system. So the phone system that's located in the halls, and they'll make an announcement that the tornado warning has been canceled. Another question, how is Westminster connected to Life Care Centers of America? That's the nursing home chain that's in the news so much with the COVID outbreak. They had the very first COVID-19 outbreak up in Washington State. And that, we are not connected with them in any way. That is not the company that manages Westminster. We're managed, and I'm an employee of Life Care Services out of Des Moines, Iowa. Life Care Services owns and or manages around 140 senior living communities across the United States. Some of them have had positive cases, but we have not had any huge outbreaks, as mentioned, of the Life Care Centers of America. Westminster is not owned by Life Care Services, but is managed by and has been managed since 1981. And I've worked for Life Care Services for almost 13 years, about the same amount of time that I've been here at Westminster. So again, Westminster is associated with Life Care Services, not Life Care Center. So if you hear that, make sure that you tell them that is not the case. We are not associated with Life Care Centers. Please, reminders, being asked to pass these reminders along from either leadership team members or other residents. Please wear your name badges. It's hard to know who you're talking to through the mask, even though masks must be worn when outside of your apartment. And also, this is a resident request, please stop feeding the birds, especially at the elevator and in the visitor parking garage, because it's causing a mess. Please maintain social distancing standard, which is 6 feet. We've talked about that many, many times. I know it's hard because you're so used to, being cordial with your neighbors and being friendly, but try to do your best to maintain that 6-foot social distance. Please wash or sanitize your hands often. I can't remind you about this enough. Wash your hands or sanitize your hands in between touching things. If you go get your mail, when you exit your apartment, as soon as you're able to sanitize your hands before you touch those elevator buttons. Then again, when you exit the elevator, sanitize your hands. When you pick up your mail, pick up your mail and take it with you. Sanitize your hands before you go back into your apartment. And then again, once you're in your apartment, wash your hands. Just do everything you can to keep your hands clean. Try not to touch your face. Don't touch your mask, even though I know it's uncomfortable and it's getting hot. Just try to resist touching your mask. Be aware of what your hands are touching. If other people have touched that item, like a doorknob or handrail or something like that, you need to be extra cautious and make sure you're sanitizing your hands. If you have a car, you may want to run that car for a few minutes once a week. At least go out there and start the car up, let it run for 10 or 15 minutes to keep your batteries fresh. We've had a lot of residents that their battery's been dead when they go out there to try and get in their vehicle. So keep those things, keep your car started and have it run at least once a week. We do have, a jump capability. We'll help you start your car if we can, when we're able to, but just stay aware of that. And if you're not using your car at all and have now found it unnecessary, it's a great time to get rid of your car. So consider that. Want to thank you all again for your cooperation and for really participating in the restrictions and really keeping each other safe, being good neighbors, good stewards. Stay strong and stay healthy. Happy Memorial Day, and thank you to all of you that have served your country. And thank you for being great residents as always and for making Westminster an extraordinary place to live and work. I appreciate you all very much. Thank you.